Hello everyone. So today I will be discussing insomnia, which is another very important topic in the psychiatry portion of Lab 2 exam. So first of all, let's discuss the differentials of insomnia as to what could be the cause of insomnia. So first and foremost, it could be any physical cause, like pain in any part of the body, like for example, joint pain or back pain or headache, or for example, heart failure. If the patient is lying down and he's having trouble breathing, then it would be difficult for him to sleep. So it could be any of the physical causes. The second most important is environmental causes. So any change in the bedroom environment. If the bedroom is very noisy, okay, if there is a lot of noise coming in, if the lights are too bright, if there are like the curtains are not much thick and the sunlight is coming in, or the room temperature is not optimal, it can be very hot or very cold. The environmental causes are also a significant cause of insomnia. Now, there are lifestyle causes which are also really significant, and there can be a caffeine consumption, especially in the especially in the evening. Okay, and then alcohol consumption and recreational drugs. And then there can be daytime naps. So, if a person is taking daytime naps, then it would be difficult for them to sleep at night. So, in lifestyle, there are caffeine and alcohol consumption and drug abuse, the recreational drug use and daytime naps. Okay, and then there can be mental health problem. So if a person, excuse me, if a person is depressed or if a person is anxious, then it can be very difficult for him to fall asleep or to maintain the sleep. Okay, so mental health problems. The mental health problem and insomnia are really closely related. So insomnia can cause low mood. Okay, if a person is not able to sleep properly, so he will be very lethargic with poor concentration during the day, and it can cause low mood. And alternatively, low mood and anxiety can cause insomnia, so they are very closely related. So make sure that you ask about mental health problems in the history. Okay, now let's discuss insomnia in terms of the three domains, that is data gathering, interpersonal skills, and the management part. So for data gathering, first we like to ask open-ended question. Okay, so I'll ask the patient, can you please tell me more about it? Okay, so the patient might tell you a story, maybe 2 3 lines. So listen to the story and try to pick up any cues. The patient might drop cues as to regarding their problem, as to what might be the potential cause. So listen to the story carefully here, and after this we'll ask close-ended question. So we'll ask, when did it start? Okay, and for example, the patient say it started 1 month back. So we'll say, anything significant happened when it started? Okay, so when did it start and anything significant happen when it started? Okay, this question here is very important because it might tell you here what could be the potential cause of, what could be the contributing cause of the patient insomnia. So when did it start and anything significant when it started? Okay, and is it difficult for you to sleep, to go to sleep, or maintain your sleep? Okay, so this is basically you are, by asking this question, you are trying to ascertain what is the basic cause, what is the basic problem in the sleep. Is it too difficult for the patient to go to sleep, or he's not able to maintain his sleep, he's waking up in the middle of the night, or he's waking up too early in the morning? Okay, so you are basically trying to pinpoint the sleep problem here. After this, we will ask about the sleep schedule. So we'll ask, at what time do you go to sleep? At what time do you wake up? And do you feel fresh and rested after you wake up? Okay, so and any daytime naps. So we are asking about the circadian rhythms here. Is it insomnia? Like the patient is experiencing insomnia because he has problem with his circadian rhythm? Is his sleeping pattern not regular? Like for example, night shift workers, whether at some during some days during the week he could be working in the morning, and then other days he could be working at night. So for night shift workers, there's a significant problem of the circadian rhythms. So you are trying to ascertain the sleep schedule here. What time do you go to sleep? What time do you wake up? And do you feel fresh and rested after you wake up? So this question is basically to know about the daytime impairment. Okay, so We want to know how much impact insomnia is causing on the patient's life. What is his daytime, what is his daytime like? Is he too impaired to function normally? Does he have poor concentration, malaise, lethargy, not able to do his daily activities properly, not able to, do his chores? If he is a student, is he able to study? If he's working, is he able to do his job properly? Okay, so sleep schedule. And then triggers. So triggers for insomnia. We'll ask about any recent change in the bedroom environment, okay? And we'll ask about what do you do in the evening? Is he drinking a lot of, caffeine in the evening? Is he drinking a lot of alcohol in the evening? Is he doing heavy exercises in the evening? Okay, so and also screen time. If he's watching a lot of TV in the evening, then it can also affect his sleep. How is your mood these days? This is basically your screening question for any mental health problem, any stresses at the moment, and any medical problem. So you want to know if there is any medical problem that can be causing insomnia. Okay, and then in the past history, you will ask about past history of mental health problem. Okay, I haven't written it here, but this is a very important question, because if patient has a past history of depression or a past history of anxiety, then you would like to know if this is another relapse. Okay. All right. Then Meftosa, are you on any regular medication? Do you have any allergy? No need to ask about family and travel history. Occupation is very important. So what do you do for a living? Okay. Patient might be a taxi driver, and if he's not sleeping at night, and he is impaired during daytime, then it could be very dangerous. Okay. Any other job, for example, working on heights, or uh, any job with involving heavy machinery. So very important to ask about the job here. All right. Then lifestyle, very important. So see here, for cigarettes, that is smoking, but also for caffeine. So but we have asked caffeine in the beginning, but if you forget to ask caffeine, then you can ask it here. All right. Then alcohol, and exercise and recreational drugs are important. If patient's doing heavy exercise just before going to sleep, then it is going to cause trouble and he's sleeping. Okay, then ideas, concerns, and expectation, very important again. You should not miss ideas, concerns, and expectation in any station. So you will ask any thoughts on your mind, what could be the cause of your symptoms? Is there anything you are concerned about? Anything in particular that you were hoping we could do for you today? For example, let's assume the patient's a sleeping pill. Could you please prescribe me a sleeping pill? So for that, then you will have to, address this concern in the management part. And the management, always keep in your mind that management is not only managing the medical problem, but managing the concerns and expectations of the patient. So for example, as we know that we have 4 marks for management in type 2 exam. So keep in your mind that 2 marks will be for managing the medical problem, and 2 for managing the concerns and expectations. So if you miss the concerns and expectation, no matter how good your medical management is, you will not score more than 2. So keep this in your mind, please. All right, examination is nothing important here, maybe vitals. Then management. So in the management part, we'll first of all explain the condition to the patient. So we'll tell them that from what I gather, it seems like you are having regular problem with your sleeping, and this is called as insomnia. There could be many causes of insomnia, but in your case, the cause seems to be whatever the cause you find out, like for example, problem is bedroom environment, or drinking too much caffeine, or a lot of stress, or anything that you find out here. Okay, then we will address the concerns and expectations of the patient. For example, the patient has been asking about sleeping pill, then we will tell the pro and cons of the sleeping pill. What we are going to do for the patient, first of all, sleep hygiene. Okay, so we'll advise on the sleep hygiene. Any problem that you have picked up in the history, for example, if the patient has, the bedroom is a bit noisy, so we'll tell the patient that try to, make your surroundings quiet and sleep inducing. Okay, if the patient's having a lot of stress, then we will advise relaxation technique, and we'll advise on the rest of the sleep hygiene, that please make your sleep timing fixed. So go to bed at a specific time every day, and wake up in the morning at specific time every day. Okay, don't sleep in. And good bedroom environment, so again, very calm, very dark and quiet. Avoid daytime naps, okay? Avoid alcohol and caffeine in the evening, avoid heavy exercise in the evening, and relax and unwind before going to bed, okay? So this is sleep hygiene. Then sleeping pills, basically short course of hypnotics. So first of all, always our first measure is sleep hygiene. So we'll tell the patient all this. We'll tell the patient that the sleeping pills, they do not cure insomnia. Basically, they only make you drowsy, and it's a temporary measure. And there are a lot of side effects associated with sleeping pills. For example, you can get dependent on them, and it will be very difficult for you to fall asleep without them. You can also experience withdrawal. So after you stop taking sleeping pill, then you can have you know your problem of insomnia can worsen. You can experience a lot of anxiety, okay? So but again, the management depends upon basically uh, the severity of the patient's symptoms and the daytime impairment. So, for example, if a patient is not involved in any risky job, there is not significant daytime impairment. So we'll just tell the patient that our first measure is sleep hygiene, and please try all these methods for 2 weeks and come for a follow-up after 2 weeks. And even if you are still not improving, then we might prescribe a um, short course of sleeping pills for you, 5 days, and it is a temporary measure, because NICE guidelines say that prescribe the lowest possible dose for shortest period of time, okay? But if the patient is having significant daytime impairment, okay, he is in a very severe condition. For example, he is a student, he's not able to sleep, and he has his exam in 3 days, okay? So what you will do then, you will advise on the sleep hygiene, but advise a short course of hypnotics. If the patient is having severe mental health issue, severe stress, then a short course of hypnotics, and also refer to psychiatry, of course, and for CBT. So always keep in mind that your first measure is always sleep hygiene, and if the patient is not improving with that, then a short course of hypnotics. But if the patient is experiencing severe daytime impairment and his condition is like acute, for example, he's having his exam in 3 days, 2 days, or something, or so he cannot wait for the sleep hygiene to work for him to function during the day. And if the patient is experiencing severe mental health, problem. Um, yeah, so that was all about insomnia. I hope it's clear to you now. This will be the end of our psychiatry portion, and I will see you soon with another video.